everyone, I am Dr. McFarland, a board-certified pediatric dentist and mom of 3. And I was trying to think of topics for my YouTube long-form videos because I'm trying to shift more into short-form content, but I want to have a few long-form videos that people can go back to of really common questions. And one of them that I hadn't really answered yet is what to do should you find out that your child has cavities. So what would I, as a dentist and a mom of young kids, they're 7, 5, and 3, if I took them to the dentist and the 5-year-old, she got her first x-rays back and we found cavities. And they were small. A lot of times what happens is we find them when those cavities are still contained within the enamel. So they haven't gotten into the deeper part of the tooth, they haven't caved in yet, but we know something's going on. There's some process that's leading to loss of mineral, breakdown of that tooth, and it could eventually turn into a cavity that needs a filling, a crown, even if it gets bigger in extraction. And at a young age, if this happens and there are multiple areas, sometimes these kids need general anesthesia at a hospital. They have to be put to sleep. That's one of the beauties of a pediatric dental specialist. We have hospital privileges. We can take children to the hospital for work, but you want to avoid that, right? So if you are one of these parents that just found out that your child has cavities and they're small and you're wanting to stop them from progressing, if not even reverse them if possible, if they're still in that enamel, sometimes you can remineralize and reverse that cavity process. What would I do if it was me? Let me tell you, from a pediatric dentist perspective, the things that I would ask for with my dentist and work on at home. Number one is I love silver diamine fluoride. This SDF is what it stands for, is a breakthrough treatment here in the US for cavities in young kids and elderly and people where it's difficult to do traditional treatment because of young age, cooperation, or old age and risks and all these things that might be associated with treatment like doing fillings, giving numbing agents, that kind of stuff. You want some type of medicine that you can treat that cavity and stop its progression. And silver diamine fluoride does that. It's been used for decades in Japan, but I think it was 2015, I don't remember exactly, but the FDA classified it as a breakthrough medication for the management of cavities. And so it's a great tool in kids. You'll see more and more dentists, especially pediatric dentists, who are familiar with it and using it. The best way so far that they talk about using it is applying it 2 times within the first year of noting those cavities. So you'll often do it at that initial visit and then at the 6-month check or maybe 3 months in between. And what it does is that silver kills the cavity causing bacteria and then the fluoride helps to remineralize and re-strengthen that area. The downside is it does dye the cavity black. So it's something that you only want to use on back teeth, so in between the teeth where the cavity is and you don't see it visibly, that's a great place to put it. And that's often where we first notice these small cavities is in between the teeth. But I have even used it on one of my kiddos on the molar, the top biting part of her backmost tooth, and I don't care. You can see it a little bit and it stopped the cavity from progressing. So it is a great tool. I used it myself as a grown-up, so you can use it as an adult too. I flossed it in between back teeth where I had early cavities trying to start postpartum because I had a lot of acid reflux that weakened my teeth. They were sensitive, so it can be a great tool to ask about even for you as an adult. But in pediatric dentistry, we should be very familiar with it, so ask your dentist if that is an option for you. Silver diamine fluoride. Another thing that we do often in the dental office that you can ask about is more frequent recares. So what we're doing, we are actively surveilling these lesions. We want to see them more often. I tend to do in my practice a 3-month recare where we're going to check them every 3 months and look and see progression and also apply fluoride varnish. Fluoride varnish is that sticky stuff that we apply at the end of cleanings. We can apply that to a high-risk cavity kiddo in areas in the front where we don't want that black staining from silver diamine fluoride. We can do that every 3 months, if not more often. So ask about more frequent fluoride varnish applications as well. And those are the 2 things you'll really focus on with a dentist. Everything else really is going to be managing that disease process at home because you want to think of cavities as a chronic infectious disease. It is caused by bacteria. The bacteria digest carbohydrates like sugar, but also starches, chips, crackers, those kind of things. When they sit on the kid's teeth for a long time, they're broken down by our spit. We have an enzyme in our spit called amylase, and it breaks down those starches that we think are salty. It breaks them down into sugar, and then it feeds cavity-causing bacteria. So that bacterial disease, we need to get rid of the bacteria, so brushing, flossing, keeping them clean, but we also don't want to be feeding them. So the first thing to figure out at home really is what could be within their diet, what they're eating or how they're eating that is contributing to their higher cavity risk, and then maybe don't eliminate, but at least mitigate that risk. So some of the common foods that parents don't realize can be increasing their kids' cavity risk are chips, crackers, pretzels, dried fruits, things that are organic or marketed as healthy but still have sugars in them. So organic apple juice is often a big one that parents don't realize. So anything that's a juice, even a flavored water that's sugar-free, can still be really acidic, and that's going to weaken the tooth and take a mineral out of it. So you want to basically, as a goal, feed your child and unless they're neurodivergent and need a more grazing type schedule, but you want to ideally have them on a routine, on a schedule for eating that includes 3 to 5 meals or mini meals, and then one snack in between those 3 big meals. So ideally just 5 times a day that they're eating. That's easy to do at school, harder when they're home, but the less frequent they can have exposures to food, that will give the teeth time to recover in between and to strengthen themselves again. Because every time we eat, our mouth gets acidic and that weakens our teeth a little bit. And so it takes about an hour, hour and a half for those teeth to re-strengthen. It's something you can look up called a Steffen's curve. But we want to help those teeth have spaced out times between food and sugary drinks so that really the only thing they should be drinking during the day is plain water, not a flavored water that's acidic, plain water. And anything else they'd like, milk, chocolate milk, juice, soda, whatever special thing you're going to give them, if anything, do it with mealtime so it's served with food and it's not going to be something sipped and exposed throughout the day. And that's a good tip for you too. If you're a high cavity risk as an adult, don't sip coffee, don't sip something all day long that may be doing small little attacks to your enamel, gently chipping away and weakening it as the day goes on. And not literally chipping away, but exposure to acids throughout the day. And little by little, your teeth are never able to recover and they can become sensitive and even form cavities. And in terms of diet, you also don't want to forget overnight. There are a lot of children who have a higher cavity risk because they're having something besides water to drink overnight. And this includes breast milk. So if you're still nursing your child and it is something that you and your pediatrician have talked about, and it's still something that you believe is necessary for your child, either for their emotional comfort, for you to be able to get to sleep, whatever, you've got to consider that as a very high risk factor for them forming cavities when it's beyond 1 year, because they're introduced to other foods, other carbohydrates. Those bacteria in their mouth are more activated to form cavities, and that sugar in the breast milk, that sugar in the bottle or the infant formula can serve as a food source for those bacteria overnight. So you have to have immaculate oral hygiene before they go to bed. Really brush, really floss, get every nook and cranny of those teeth squeaky clean using fluoride toothpaste in the grain of rice size amount if they're under age 3, a pea size amount if they're over age 3. And if you can, if they're awake after that bottle, even if they're kind of semi-lucid, wipe their teeth off, get that extra milk from underneath their lip, wipe it off with something like a Dr. Brown's or a Spiffy's xylitol wipe. And then if you can, if they're awake enough, have them drink even some water to help cleanse and get that carbohydrate away. But reducing overnight drinking of anything except plain water will greatly reduce their cavity risk as well if you've got a high cavity risk kid. Now we mentioned briefly toothbrushing, so we've got to get rid of those bacteria. Bacteria do hide out in between the teeth. The toothbrush bristles can't reach there. So you want to try and floss, use those little floss picks that look like U-shaped. That's going to be the easiest thing to get there in between their teeth and those small mouths, and clean every spot where their teeth are touching side by side. So if they've got big spaced teeth and there's no big food debris stuck in there, you don't need to be flossing, although you can still be using it to teach them about the process. But in the back where the teeth are touching together, you want to try every day if you can. That's an A+ grade if you can do it, to floss those teeth. I like to floss and then brush after at nighttime before bed. And then in terms of toothpaste, I do recommend a fluoride toothpaste. Fluoride helps incorporate into our enamel as not just a hydroxyapatite crystal, that's what's normally in our enamel, but it tags on a fluoride ion and it forms fluorapatite. And fluorapatite crystals make our tooth, that enamel, more resistant to future acid breakdown. It's not as likely when exposed to acid to leach out into the saliva and weaken. So it just is a shield for the tooth. So I recommend fluoride in safe and recommended doses. You use a grain of rice-sized amount as recommended by the AAPD, the American Academy of Pediatric Dentistry, for kids ages 0 from the time that first tooth comes in until they turn 3. Once they turn 3, you up it to a pea-sized amount and you never need more than that, okay? And we expect them under age 3 especially to be swallowing almost all of that. And I've got a whole section in my course if you want to go through about fluoride safety. I can link that down below, and I talk about all these things and so much more in my program called Tantrum-Free Toothbrushing, Cavity-Free Without the Tears. I go through fluoride, I go through products, I go through what toothbrush to use, how to mitigate all these risks, systemic things that I'm not really going to touch on here. But if you've got a child with a medication or chronic dry mouth from a medication or otherwise, frequent acid exposure, say acid reflux, how are you mitigating risks for that child? I'll walk through that in my course too, so I'll link that below. But toothbrushing wise, you want to use those appropriate amounts of toothpaste morning and nighttime. I like to brush my kids as soon as they wake up, so we get ready for the day, brush their teeth, they go have breakfast, and then they can chew a piece of gum afterward to clean off any food if they're old enough, or you can do a quick brush after, or you don't necessarily have to because you've cleaned off those bacteria. It's not as risky having that little bit of food on there as they go to school. Some people think they need to brush their teeth after breakfast, but actually brushing before breakfast, cleaning away those bacteria, that's the most important part. And if you get busy in the hustle and bustle of the morning and don't have time to brush again, that is okay. But if your kids are old enough, you can have them chew a little piece of sugar-free gum. Same is true for you as an adult. And then at nighttime, you want to be brushing before bed. I floss and then I brush them, and then I have them spit, not rinse. If they're not good at spitting the toothpaste, they're not good at spitting the water either, so they're actually going to swallow more. So if you're worried, just wipe their tongue off with a washcloth, but have them spit spit, don't rinse with anything. You want that fluoride to stay on their teeth, that little bit of film that's left over after they've spat, and to go to bed. And doing that toothbrushing before bed, that's going to help, again, fortify their teeth with that fluoride before they go to sleep. If my child was old enough to spit and use a mouthwash, which tends to be age 5 to 6 most definitely, and I do have a video I'll link down below how you would know if your child was ready to use mouthwash, but you can add a fluoride mouthwash into their routine at another time of day. So after lunchtime if they're at home, or say when they get home from school, you can have them rinse with fluoride, just again to get a little more fluoride exposure for them topically to help strengthen that enamel. 3 other things you could do if you can afford it, and these are not things that you must do. There is not a high level of evidence to support either of the 3, but it's just another thing that you can add if you're trying to throw anything that you can at them to help lower the cavity risk. One is a dental probiotic. I really like Super Teeth. They have high quality, they're a good company, they have lots of checks in place to make sure they're creating a potent product and a safe product. I do have them affiliate linked below, and so you can check those out. But a dental probiotic, as long as you're taking it, the cavity causing bacteria can be weeded out by the good bacteria. If you're increasing the good bacteria in their mouth, there's not going to be as much room for the bad bacteria to grow, especially as you're brushing and cleaning away the bad bacteria. Hopefully the good bacteria can proliferate. Studies seem to show that change though of taking the probiotics is transient, so it doesn't forever shift the balance. And so that's the downside of probiotics, is it's helpful as long as you're taking it, and they're not inexpensive. So just look at the cost, see if that's something your family can afford, but that might be one thing to throw, kind of add up. The least expensive thing that you can add is something I mentioned earlier, is xylitol gum or xylitol mints, depending on your child's age, if they're able to safely chew gum. But the xylitol gum is especially best if they're able to do it because it helps to clean off their teeth after they get food debris stuck in it. So it's really nice after a snack at home or after a meal if you're not going to brush their teeth. But xylitol has some dental benefits in studies with frequent and prolonged use. The ideal for adults is like 5 to 6 times a day, a total of 6 to 10 grams of xylitol. That's a lot for a kid. We don't really have a good measure of what we think would be equivalent for a child, although the dosing may be just as high because it's impacting the bacteria, not the kid's body. But that may be too much for a kid. They might get some gastric distress from that much xylitol, upset tummy, bloating. So just watch your child and give them what seems to fit with their tummy and what you're able to afford to give them to. But a xylitol mint for a younger child can be just as helpful as long as it's small and it's not a choking hazard. You're still going to get that xylitol benefit of that sugar that the cavity causing bacteria cannot digest, and so it helps to stop those cavity causing bacteria from thriving. So even if they don't get the chewing of the gum to help get that food debris off, you're still getting some benefit from that xylitol mint. And then lastly, something that I actually put in my kids' lunch boxes and that we use as an after toothbrushing treat is something called Basic Bites. It's actually a little chew. They have caramel or chocolate flavor. They taste pretty good, like a Tootsie Roll or like a Werther's like butterscotch kind of type of candy, but they chew that after toothbrushing. These chews contain vital nutrients for promoting dental health. There's calcium, there's arginine, and there's bicarbonate. So they help to neutralize pH, which we know acid is the problem, and then they help to promote remineralization, putting mineral back in the tooth. That's where that calcium comes in. It helps in the formation of hydroxyapatite and fluorapatite. It does not interact negatively with the fluoride from the toothpaste, so you can use that chew along with toothbrushing. You floss, brush, and then use that chew after bed. It's a great little motivator for after toothbrushing time. And then I also put it in my kids' lunch. That's the last thing they eat after lunch because they're chewing it. That's going to clean off any food debris. Then they get those beneficial nutrients to help keep their enamel healthy. So those are 3 things. If you can add them, that's something that you could try as well. But really the 2 biggest takeaways are figuring out what within diet and within home hygiene could be contributing to a higher cavity risk. What's missing in that puzzle? Are you not using fluoride? Are you not brushing right before bed? Are they getting a snack and sneaking down and having something to eat throughout the night that you don't realize? Are they snacking frequently throughout the day on things that are salty that you didn't realize could actually contribute to cavities, that kind of thing? Once you and your dentist and hygienist figure out that cause, addressing that cause is one of the most important things you can do. And then some of those other tools I mentioned can be helpful. If, as I talked about just briefly, a systemic condition is involved, talk with your dentist about specific implications of certain conditions or medications, and they can help you formulate just a unique plan for your child as well. And if you would like more information broadly about that, again, I'll share the link to my course down below. Thanks so much for watching. I hope you found this helpful. Please know that even the dentist kids get cavities, even dentists themselves get cavities. You're not a bad parent if your child develops dental cavities. It is the most common chronic disease of childhood, even more common than asthma. So many kids get cavities, but the question is, once we find out they have them, what do we do? Can we stop the process? Can we even reverse it? And in many cases, when we catch it early enough, we do. As the AAPD recommends, if you've got a young one, do get them in for their first dental visit by their first birthday. That is the official American Academy of Pediatric Dentistry recommendation and has been for 20 years. If your dentist or your pediatrician tells you otherwise, they're misinformed or they're just not up to date on the recommendations. Your baby should see the dentist by their first birthday or within 6 months of their tooth coming in. That helps us catch things early, identify root causes, and stop cavity cavities in its tracks before it gets big and needs invasive treatment. We would love for every child to be cavity free, or if they get cavities, to catch them when they're small and only need non-invasive treatment like we shared here. So I hope this taught you a little bit. If you have any questions, let me know down below. Be sure to hit subscribe and then join, because I am going to be going live regularly where I will answer your questions if you have something specific that wasn't answered that you want to know about. You can let me know in the comments too, and I'll add that to the list of future topics. I appreciate you. Thanks for being here. And here is the video that YouTube wants you to check out next.